Hello, everyone. Welcome to this week's Wellness Wednesday. I'm Dr. Phillip Redd. And, I want to wait just a couple minutes. I know we've waited 3 minutes so far, letting everybody jump on. Let's see if we got a few more that want to hop on. Okay. And while we're waiting, I just have to admit that lately I have been working long hours, longer than I really want to. I've been arriving very early, staying and sometimes even burning the midnight oil, so to speak. And it's time that I have spent really just working and caring for my individual patients with their chronic thyroid conditions, insulin resistance, type 2 diabetes, and mentoring and organizing staff, running a business. And on top of that, trying to find time to attend my son's track meets and my daughter's dance recitals, certainly, doing things around the house, change air filters and maybe do a little yard work. Sometimes it just feels like I'm on thin ice. And well, I think you probably get it too, where you get it because you feel that way sometimes too. Like you're at that moment, it could just break at any moment. And it's just the dealing with the ups and downs, sometimes with your mood, sometimes just with stress. Like, it's often beyond your ability to really deal with it sometimes, or control. It's definitely beyond your ability to control. At least that's what it feels like. And so you deal with anxiety and depression and this oftentimes it's this yo-yo of both of these things going on. And for some of you, it's multiple times throughout the day. Others, it's just kind of occurring on a day-to-day type basis. And that's, it gets difficult. And it's yeah, obviously nerve-wracking, but you wonder why this happens, why this is going on in your brain. And that's really what I want to talk about. As I thought about this topic of anxiety and depression, it's because I've got so many patients who come to me dealing with these ups and downs, and they just don't have any answers. These are symptoms of hypothyroidism, and in some respects hyperthyroidism. And I'm going to talk a little bit about that, but it really is interesting to consider all the different mechanisms that are going on here to cause these sometimes waves of depression, or these bouts of anxiety, anxious thoughts, and really, like I said before, where you really don't feel like you're in control. And oftentimes, like, there's this battle going on inside. And frankly, before I get to the mechanisms that I want to discuss, it's difficult for you to explain this to other people, especially your spouse, those around you, those who are, those care about you, but you're not sure that they could even understand where you're coming from. And it's just difficult to explain. And this causes issues, as some of you might very well know. This causes relationship issues. And so I think if we understand the mechanisms, and when we understand the mechanisms, we can find the causes and fix those, and see this kind of level out, this yo-yo thing, level out, so that you stop the up and down, back and forth, being all over the place. Now, the first mechanism I want to talk about with this actually is leaky gut. And leaky gut is a term, some of you may have read a lot about this. Some of you may just have recently heard about this. It's kind of it's a term that the scientific term is increased intestinal permeability. It's a lot easier to say leaky gut. Well, this is caused by irritants entering into your intestines. Well, what is that from? It's from food that is not digested. It's from food additives. It's from preservatives that are in your food. It's from foreign substances that really shouldn't be in our food, but we all know they are. And these impact the lining of the gut, causing these basically these gaps to open in between the lining, the cells lining the intestine. And that's where an immune response happens almost immediately. And what happens is these undigested things, particles, and even other things leak into the bloodstream right then and there, like bacteria and toxins from the bacteria, like LPS, lipopolysaccharide. I don't want to get too far in the weeds, but you might come across this sometime. And what happens is these particles, these things get trapped by immune cells, white blood cells, and these travel, first of all, right to the liver. And that immediately causes an inflammatory response in the liver. This leads to insulin resistance and trouble with, raising your blood sugars, and this is what leads to being overweight with leaky gut. This whole process can lead to things like joint pains and headaches and allergies and asthma and just fibromyalgia, so many other things. Well, why does it cause anxiety and depression? Well, some of these cells get so inflamed, these enteric endocrine cells that help you make something called GABA. And there are drugs that we are hearing about recently as well that knock these cells out, causing a decreased production of GABA. All right. So GABA, you need gamma aminobutyric acid to calm down. And when you lack GABA, you may not be able to sleep well. You're going to have anxious times of anxiety or anxious thoughts sometimes, and just feeling on edge. Now, the next mechanism that I want to discuss is Hashimoto's. Well, let me back up, because I started to talk about the blood sugar thing and insulin resistance. So we better talk about that. Just moving from the gut to the liver, that mechanism causing insulin resistance. And when your cells, especially your brain cells and your nerves, lack glucose because the insulin doesn't work to get glucose inside, well, they can't function properly at that point. You will have less and less of your brain cells functioning, and this leads to a depressive state. This can lead to an anxiety state, and so you get the symptoms. So you have, you feel like you're, like I said, out of control and not able to really get a handle on things. Sometimes just feeling overwhelmed and not able to think clearly when you're stressed, going through a very stressful time in your life. So this is the mechanism with blood sugar and insulin resistance. So the next thing I want to talk about is Hashimoto's. You need to understand that Hashimoto's is not just a thyroid condition. It is a brain, a neuroinflammatory condition, or even a, a neurological autoimmune condition, because it can affect the cerebellum and cause problems with again feeling a little bit off balance and less coordinated, and this decreases cognitive function, which we often call brain fog. The other way this affects Hashimoto's affects the brain and causing these kinds of feelings is when the immune system in Hashimoto's, the immune system attacks and destroys the thyroid. And so when the cells in the thyroid are destroyed, they release hormone into the system. And the more thyroid hormone you get in your system, this causes overactivity, hyperactivity of your tissues. So you can get hyperactive neurons, and this can lead to a feeling very similar to anxiety. This is the same thing. I know a lot of you have wondered about hyperthyroidism, and if it's related to this, and certainly Hashimoto's can cause this state of hyperthyroidism, and this is exactly what it can feel like. It can feel like you're on edge, you're shaky, you're jittery, you're maybe a little trembly, or you're just feeling amped up. And this is exactly what Hashimoto's can feel like. And for some, it goes on for quite a while. Doctors will, you go to the doctor and they'll tell you that it's Graves, that your thyroid needs to come out, that they need to do a radioactive iodine treatment to ablate the thyroid. I mean, it's crazy that unless they were to really get all the right information, that they're not considering that it's Hashimoto's. And unfortunately, what happens is it'll calm down at some point, or it can often calm down, and then you go severely hypothyroid. So as I mentioned before, Hashimoto's is a really common mechanism for these ups and downs, these anxiety, depression yo-yos that I was talking about. Let's talk about brain inflammation. So these antibodies, Hashimoto's is like I said, it's characterized by antibodies against the thyroid tissue. And not only does it affect thyroid tissue, but it affects certain parts of your brain. And I mentioned the cerebellum. And so, yes, this is why this happens, because these antibodies can also affect the cerebellum of the brain. And then, like I say, with all this, you can feel fatigued, depressed, or anxious, lack of cognitive function, brain fog, and it just can't seem to put it together. Can't seem to think about things in a clear and concise manner when you really need to. So with all this said, with all these mechanisms that I've shared, I want to tell a couple of patient stories, because while I said it's interesting to consider this topic, because honestly, I have so many patients dealing with this, but it is really wonderful to see it stabilize. It's so wonderful. One of my patients has been working on with her customized plan of care, and has really been able to, she's been able to tackle the biotoxins. I did a Wellness Wednesday in the past on biotoxic illness, and these biotoxins, mold especially, Lyme is a consideration, there's a possibility, cause the inflammation, it can cause the autoimmunity, can cause the trouble with thyroid, and this is something she was dealing with, and she was on 2 different antidepressant, and she was on an antidepressant and a mood stabilizer. Unfortunately, she's been dealing with hypothyroidism for her whole life. She has been unable to have children, and she is at the age, at the point, she's probably in her mid 40s at this point. I believe she's in her mid 40s. She is trying to overcome this because she desperately wants to adopt. And she has been able to clear these toxins with the right process. And instead of, so I don't know if any of you have gone through the adoption process, but they have to do evaluations on you. They have to do like a neuro psychiatric evaluation to see if you're able to handle these kids. And so before she started her program, she was all over the map. She was up and down, like I've been describing, almost bipolar-like, which is why she was put on a mood stabilizer. Anyway, so she has been able to now wean off of the mood stabilizer, is still in the process of weaning down off the antidepressant, but she is so happy. She comes in, last time she came in, just a huge smile on her face. She's clearly a different person than from when I first met her and evaluated her before taking her case. And she is now getting into the adoption process, has passed the neuropsychiatric evaluation, and is just waiting for the next step to be able to adopt. And so it's wonderful. She's fulfilling her lifelong dream because she hasn't been able to have kids of her own. And so I want to tell another story. And so this patient, she's gone through a lot. She had been battling depression and anxiety, and then and she is also in, she is in her early 50s, and she works, but she has been dealing with the passing of her husband. He passed fairly suddenly, about a year ago, and she has just had to pick up the pieces, right? She has had to deal with this grief, this loss, and has had to make up all the difference for what he contributed financially and so forth. But you can imagine what she's gone through. And I just met with her actually earlier today, and she's lost 41 pounds in about 4 months. She does not have these emotional ups and downs. She's excitedly talking to me about her son going to the state rodeo and competing next week. And her demeanor is clearly different than when she started. She certainly is sad at times, she says, but she is doing everything that she can, all the direction that I've given her in her care program to reverse the symptoms of her hypothyroidism and get out of the brain fog, which she had a lot of, to get her energy back. Her energy is at least doubled from what it was. And it's just, guys, this is why I do what I do. And I know that these ups and downs, these anxiety and depression yo-yos that I call them, once you find the mechanisms and the causes are identified, and once you can fix them, you can regain the balance, restore the balance. Yes, even in your brain, in your energy, because this life requires energy. And I described some of these mechanisms whereby sometimes your neurons don't get enough energy, or they get too amped up because of these imbalances that we've discussed. So I think that about covers what I wanted to discuss. And I thought that it would be nice to maybe have a short question and answer period. And so if you would like to put some of your questions in the comments section, then I can go ahead and answer those to round out the session. So. Okay, so one of the questions I have is, can you tell me some of the ways I can tell if I have an insulin problem? Well, first off, if you are overweight, you most likely have an insulin problem, because insulin is the fat storage hormone. It's going to help store excess glucose in adipose tissue. And so that's the first sign. Certainly, if you get lab work, the right lab work done, where your doctor could check your insulin levels, there are your normal, abnormal ranges, but within those ranges, there are functional and dysfunctional ranges. And so there is a functional range. And if you are outside of that, then you most certainly have an insulin problem. Generally, if it's above 10, then you are likely dealing with insulin resistance. And if your blood sugar is high, yeah, there's an insulin problem. I think those are the most common things. I have another question. Let me see about that. What is the connection between estrogen therapy and Hashimoto's? So in Hashimoto's, this is an autoimmune process that is triggered by immune system triggers. And so what are those triggers? Well, hormone surges are some of these triggers. And so when you have hormone estrogen replacement therapy, you've got usually too much estrogen on board at one time, which will trigger the autoimmune process, trigger the immune system to then go attack and destroy the thyroid tissue. One of the other ways that this affects thyroid function is this can cause estrogen dominance. And when you have the autoimmunity underneath and you have estrogen dominance, this can impact the carriers for your thyroid hormone, the thyroglobulin. And So this is why you'll have a disruption in thyroid function, because you're not going to be able to have enough thyroid delivered to your body, and every cell in your body needs thyroid hormone. So there's a couple of ways. Let's see. All right. So the question is, I have hyperthyroidism. Should I be taking iodine? And so if you've been diagnosed with hyperthyroidism, iodine will likely make that worse. Part of the problem is we need iodine to make thyroid hormone. And usually, like I said, hyperthyroidism, this hyperthyroid state, is caused by an autoimmune process. So what causes the autoimmunity to flare, to ramp up? Immune system triggers. And so oftentimes iodine can be excess, we call it exogenous iodine, can act as that immune trigger. All right. So it's, and this other question isn't the root cause of Hashimoto's autoimmunity. That's exactly what Hashimoto's is. It is autoimmunity. It is the autoimmune condition that affects the thyroid gland. But as I've mentioned here tonight, it also affects the brain directly. So. This question is kind of interesting. I've been told I'm on the verge of having Hashimoto's. What does that mean? I like to look at it this way. When you get these blood tests, you're diagnosed with Hashimoto's when you have positive blood tests for positive TPO or thyroid peroxidase antibodies or thyroid globulin antibodies. And you really shouldn't make any of them. When you do, those act as targets. What's in the bloodstream also does not necessarily indicate what's in your thyroid gland. So then don't get confused by, well, it's low, it's within normal range. If you're making these antibodies at all, there's a chance that you are actually dealing with the mechanism that is Hashimoto's. So I would treat you the same. I would try to get rid of your immune triggers with you, right? We would try to suppress those. And that's what has to happen to help bring this autoimmune condition into remission. Is Bell's palsy linked to Hashimoto's? All right. I think, first of all, I think I'll maybe take one more question after this. But okay, Bell's palsy is a neurological condition where the cranial nerve that controls your face is affected, and you basically lose motor function in your face, on one side of the face. And so you get a droopy eye, you can't maybe close your eye, droopy mouth, and it's not fun. Your eye dries out, it's not fun. Bell's palsy usually is a viral condition caused by a virus, usually in the herpes virus family. And in a way, Epstein-Barr virus could be a cause. And so certainly Epstein-Barr virus can be implicated as a cause of Hashimoto's. It is a common, one of the common triggers for Hashimoto's. So yes, that is how that is linked. Okay, so last question. What are your thoughts on levo and NP meds? So what that means is levothyroxine and NP is a type of porcine or pig-based desiccated thyroid. It's a prescription desiccated thyroid. So these hormone replacement forms are, my thoughts are, because of the way they are made and how they when you take them into your body, they're not often very well processed or absorbed. And so I think that people have trouble getting any benefit from these most of the time. I won't say all the time. I would say maybe 20% you might benefit. 20% of the time you would benefit from taking these forms of thyroid replacement. They are made with fillers and binders that keep the little tablet things together. And some of these are like lactose, they're cornstarch based, they're grain based fillers and binders that keep these little tablets together. And those of us who are sensitive to those types of things, which I think all of us are, actually, that's a topic for another day. These may not treat our systems very well, and they actually might also be immune system triggers, because they are not allowing that thyroid hormone to really do its job in the best way possible. So I don't like to use those forms of the medications. There are some other options, but when you need them, you need them. And sometimes that's your only option. So a lot of times it comes down to other factors for why they don't seem very effective. So give the process a chance, find out the root causes for these other symptoms, the symptoms you're having with hypothyroidism. And as you find those root causes, name especially the inflammation that generally is what causes those symptoms. This can help these work better for you. So it just needs to be a process. You need to go through that process to really see if they're going to be effective or not. Okay, I would encourage you to type some other questions in the comment section. I can get offline and maybe type out a few answers. But I've really enjoyed my time with you this evening, this Wellness Wednesday. So I look forward to the next opportunity we have. Take care, everybody.